I am about to reveal the specific liquid that can significantly increase the blood flow to your legs and feet, helping to reverse that sensation of heaviness and coldness that limits your mobility. Poor circulation in the lower extremities is not just a natural consequence of aging that you simply have to accept, but is often a sign that your blood vessels have become constricted or stiff, preventing oxygen-rich blood from reaching the nerves and muscles that need it most. By introducing specific compounds into your bloodstream through what you drink, you can trigger a natural biological process that relaxes these vessel walls and allows blood to surge back into areas that have been starved of proper circulation. I am Dr. James Williams. Throughout my time treating older adults in clinical practice, I have seen countless patients regain their ability to walk comfortably and sleep without leg pain simply by adjusting their dietary intake to support vascular health. When we focus on the biology of the blood vessels rather than just treating the pain, we often see improvements in walking distance and sensation that patients did not think were possible at their age. You may have noticed symptoms that seem minor at first, but are actually warning signs of declining peripheral circulation, such as feet that feel perpetually cold even when wearing socks, or a nagging heaviness in your calves when you try to climb a flight of stairs. You might see that the skin on your lower legs looks shiny or has taken on a pale or slightly bluish tint, which indicates that the tiny capillaries are not receiving adequate flow. Perhaps you experience swelling around the ankles at the end of the day, or a tingling sensation that feels like pins and needles when you have been sitting for too long. It is crucial to understand that your current doctor might have overlooked these early signs or simply attributed them to general aging, perhaps advising you to just walk more or stay hydrated without explaining the specific mechanisms needed to open those blood vessels. This lack of specific guidance can be dangerous because untreated poor circulation can lead to tissue damage, non-healing wounds, and a significant loss of independence as your mobility declines over the years. We need to take proactive steps now to widen those arteries and ensure your blood is not too thick to travel through the complex network of vessels in your legs. 1. Drink raw beetroot juice. The first and most powerful drink you should consider incorporating into your routine is raw beetroot juice, specifically focused on its high nitrate content. This is not about general hydration, but about using food as a potent vasodilator to mechanically open up the arteries in your legs. When you ingest the natural nitrates found in beets, your body converts them into nitric oxide, a gas that signals the smooth muscles lining your blood vessels to relax and widen immediately. This expansion allows a greater volume of blood to flow through the femoral and popliteal arteries in your legs with less resistance, effectively delivering oxygen to tired muscles and cold feet. This is a critical intervention because as we age, our body's natural ability to produce nitric oxide declines significantly, leading to the stiffening of arteries that restricts flow to the extremities. Drinking beetroot juice effectively bridges this gap by providing an external source of the precursor needed to generate this molecule, acting almost like a natural medication for your vascular system. The effect is often noticeable within a few hours of consumption, making it one of the fastest ways to impact your circulation readings and physical sensation. I remember a patient named Robert who was 68 years old and complained that his legs felt like lead weights every time he tried to walk his dog around the block. He had assumed his walking days were over, but after introducing a small daily glass of beetroot juice, he reported that the heaviness began to lift within a week. He made the mistake of thinking he needed medication for energy, but the correction was simply improving the oxygen delivery to his leg muscles, which allowed him to double his walking distance without pain. To get the benefits, you do not need to drink a large amount. 4 to 6 ounces of fresh, raw juice is typically sufficient to spike your nitric oxide levels. You should aim to drink this in the morning or about 2 hours before you plan to be active, as this times the peak nitric oxide production with your movement. It is important to make this yourself using a juicer if possible, or buy 100% pure organic beet juice with no added sugars or apple fillers, as the concentration of nitrates is what matters most for the medicinal effect. There is a simple way to make this palatable if you dislike the earthy taste, which is to mix it with a small amount of carrot or celery juice, but avoid using high-sugar fruits which can counteract the health benefits. You should sip it slowly rather than gulping it down, allowing your saliva to begin the conversion process of the nitrates before they even reach your stomach. Consistency is key here. Taking it sporadically will not yield the sustained widening of the vessels that is necessary for long-term circulatory repair. A necessary caution is that beetroot juice is high in oxalates, so if you have a history of calcium oxalate kidney stones, you must consult your doctor before adding this to your daily regimen. You should also be aware that it can turn your urine or stool a pinkish or reddish color, which is a harmless side effect known as beeturia and should not cause you alarm. This simple addition to your diet supports steadier blood pressure readings and warmer extremities. 2. Warm water with fresh lemon. The second item is a fundamental foundation for circulation that is often ignored: drinking warm water with fresh lemon juice immediately upon waking. While this sounds incredibly simple, the temperature and the timing are what make it a medical lever for your blood flow. During the night, your body loses a significant amount of water through breathing and perspiration, causing your blood to become more viscous or thick by the time you wake up. Thick blood requires much more effort from your heart to pump down to your legs and has a harder time returning against gravity, leading to that morning stiffness and swelling. By introducing warm water first thing in the morning, you rapidly rehydrate the vascular system and dilute the blood, making it easier for it to flow through the tiny capillaries in your feet and toes. The warmth of the water is crucial because cold water can cause a temporary constriction of the blood vessels in your stomach and esophagus, whereas warm water encourages vasodilation and aids in the digestive process. The addition of lemon provides citrate, which helps improve blood viscosity and supports the liver in filtering toxins that can otherwise impede efficient circulation. I once treated a patient named Margaret, age 72, who suffered from chronic dizziness and perpetually cold hands and feet every morning until noon. She made the mistake of starting her day immediately with strong coffee, which acted as a diuretic and further dehydrated her, worsening her circulation issues. Once she corrected this habit by drinking 12 ounces of warm lemon water before her coffee, her morning dizziness vanished and she noticed her extremities warming up much faster. The mechanism here is primarily about fluid dynamics. Just as it is harder to pump sludge through a pipe than water, it is harder for your heart to push dehydrated blood into the deep veins of your legs. Ensuring optimal blood volume through hydration reduces the workload on the heart and prevents the stagnation of blood in the lower limbs that contributes to clot formation and varicose veins. The lemon also provides a small burst of vitamin C, which is necessary for maintaining the strength and elasticity of the vein walls themselves. To do this correctly, heat your water to a comfortable, drinkable temperature. It should be warm, not scalding hot. Squeeze half of a fresh lemon into the water. Do not use the bottled concentrate found in grocery stores, as these often contain preservatives like sulfites, which can be irritating. Drink this entire glass while sitting down calmly before you eat breakfast or drink any caffeine, giving your body about 15 to 20 minutes to absorb the fluids and prime your circulatory system for the day. You should be cautious if you have severe acid reflux or sensitive tooth enamel. You might want to drink this through a straw to bypass your teeth or rinse your mouth with plain water afterwards. It is a gentle yet profound way to ensure your blood flows freely from the moment you start your day. This supports a healthy fluid balance that reduces ankle swelling. 3. High-quality green tea. The third vital beverage for your leg circulation is high-quality green tea, brewed correctly to preserve its potent catechins. Green tea is distinct from black tea or coffee because it is rich in a specific antioxidant known as EGCG, epigallocatechin gallate, which has been extensively studied for its ability to improve the function of the endothelium. The endothelium is the thin membrane lining the inside of your heart and blood vessels, and its job is to control when vessels expand and contract. In many seniors, this lining becomes sluggish or damaged, leading to chronic constriction. Drinking green tea regularly helps to revive the function of these endothelial cells, allowing your arteries to relax and accommodate more blood flow to the lower body. Research suggests that the consumption of green tea can rapidly improve flow-mediated dilation, which is a measure of how well your arteries respond to blood flow, within just 30 minutes of consumption. Over the long term, the antioxidants in green tea also help to prevent the oxidation of LDL cholesterol, which is the process that causes plaque to stick to artery walls and block flow to the legs. I recall a patient named David, 65, who had borderline high blood pressure and complained that his legs felt stiff and wooden after sitting for short periods. He was drinking 5 cups of coffee a day, which was keeping his stress hormones high and his vessels tight. By swapping 2 of those coffees for green tea, he not only lowered his blood pressure, but reported that the stiffness in his legs dissipated significantly over the course of 3 months. The key to unlocking this benefit lies in the preparation, as boiling water can actually destroy the delicate catechins that you need for your circulation. You want to steep the tea for at least 3 to 5 minutes to allow the antioxidants to release fully into the water, but avoid using water at a rolling boil. It is best to let the water sit for a minute or 2 after boiling before pouring it over the tea bag or leaves to avoid scorching the compounds. You should aim for 2 to 3 cups daily to maintain a steady level of these protective compounds in your bloodstream throughout the day. While decaffeinated versions exist, the processing often removes many of the beneficial flavonoids, so if you can tolerate the mild caffeine, the regular version is superior for vascular health. However, because it does contain caffeine, you should avoid drinking it late in the afternoon or evening so that it does not interfere with your sleep quality, which is also vital for heart health. If you are sensitive to tannins or find that tea upsets your stomach, try drinking it after a meal rather than on an empty stomach to mitigate any nausea. It is a soothing habit that works biologically to keep your arterial pathways flexible and open. This supports the long-term flexibility of your blood vessels. 4. 100% pomegranate juice. The fourth powerful addition to your diet is pure pomegranate juice, which is often referred to in nutritional circles as a scrubber for the arteries. Pomegranate juice is exceptionally high in antioxidants, specifically punicalagins and anthocyanins, which are far more concentrated in this fruit than in red wine or blueberries. These compounds play a dual role. They protect nitric oxide from being destroyed by oxidative stress in the body, ensuring the signal to open your vessels lasts longer, and they help reduce inflammation within the vessel walls. For seniors, this is particularly important because inflammation is a primary driver of atherosclerosis, the hardening and narrowing of arteries that significantly reduces blood flow to the legs. Clinical studies have indicated that consistent consumption of pomegranate juice can reduce the thickness of the carotid artery intima media, suggesting a reversal of plaque buildup and a restoration of healthier blood flow. By keeping the interior of the vessels smooth and inflamed, you reduce the turbulence of blood flow, allowing it to reach the capillaries in your feet more efficiently. A patient of mine named Susan, aged 70, came to me with concerns about cramps in her calves that occurred every night, a classic sign that her muscles were not getting enough oxygenated blood. She made the mistake of thinking it was just a magnesium deficiency, but supplements didn't help. After she began drinking a small glass of pomegranate juice daily, the frequency of her cramps diminished significantly, and her latest ultrasound showed improved flow metrics in her lower legs. It is critical that you read the label carefully when buying this, as many products are sold as pomegranate cocktails that are loaded with high fructose corn syrup and contain very little actual juice. You must look for 100% pure pomegranate juice, which will have a tart and somewhat astringent taste due to the tannins. Because it is naturally high in fruit sugars, you do not need a large glass. 4 ounces a day is a medicinal dose that provides the benefits without spiking your blood sugar excessively. You can dilute the juice with water or sparkling water if you find the flavor too intense, making it a refreshing afternoon drink that replaces sugary sodas or teas. The goal is to bathe your blood vessels in these protective antioxidants daily, creating an environment where plaque struggles to form and blood flows without resistance. This is a long-term strategy that pays dividends in preventing the progression of peripheral artery disease. There is a very important caution here. Pomegranate juice interacts with the liver enzymes that metabolize many common medications, similar to grapefruit juice. If you are taking statins for cholesterol or blood thinners like warfarin, you absolutely must speak with your doctor before adding this to your diet to ensure it is safe for you. This supports the structural integrity of your arteries against aging. 5. Ginger tea. The fifth drink you should consider integrating into your daily routine is ginger tea, a warming beverage that directly stimulates circulation through its active compounds, gingerols and zingerone. Unlike the passive dilation from nitric oxide, ginger works by creating a mild thermogenic effect in the body, essentially generating internal heat, which prompts your nervous system to dilate blood vessels in an effort to cool you down. This mechanism is particularly effective for those who suffer from chronically cold hands and feet, as it physically pushes blood from the core out to the extremities. In traditional medicine and modern nutritional science alike, ginger is recognized for its ability to inhibit the production of prostaglandins and leukotrienes, which are pro-inflammatory chemicals that can cause swelling and stiffness in the veins. By reducing this vascular inflammation, ginger allows blood to move more freely and can even act as a mild natural blood thinner, preventing the platelets from clumping together and forming clots in the deep veins of the legs. This is essential for seniors who are less active, as stagnant blood is the primary risk factor for deep vein thrombosis. I recall treating a patient named James, a 74-year-old retired teacher who wore compression socks daily but still complained that his toes felt frozen even in the summer. He had the mistake of relying solely on external heat sources like electric blankets, which only warm the skin surface. The correction was to heat the body from the inside out using ginger tea twice a day. Within 2 weeks, he reported a noticeable, sustained warmth in his feet and less reliance on heavy socks indoors. To prepare this correctly, fresh ginger root is far superior to dried powder or tea bags because the essential oils are more potent. You should slice about an inch of fresh ginger root into thin rounds and simmer them in water for 10 to 15 minutes. Simply pouring hot water over them is not enough to extract the medicinal oils. Strain the liquid and drink it while it is warm, perhaps adding a touch of honey if the spicy kick is too strong for your palate. It is best to consume this mid-morning or mid-afternoon, acting as a circulatory booster between meals to keep blood moving when your metabolism might naturally slow down. You can also add a pinch of turmeric and black pepper to the brew, which works synergistically with ginger to further reduce inflammation and improve vascular flexibility. This creates a potent anti-inflammatory cocktail that tastes comforting while actively improving your physiology. A word of caution is necessary for those on strong prescription blood thinners or those preparing for surgery, as ginger's natural anti-clotting properties can increase bleeding risk if consumed in very large amounts. Always clear significant dietary changes with your cardiologist. This supports the active delivery of warmth to your farthest extremities. 6. Low-sugar dark cocoa. The sixth item on our list might surprise you, as it feels more like a treat than a medicine. Hot cocoa made from low-sugar, non-alkalized dark cocoa powder. The medicine here is a group of compounds called flavonols, which are exceptionally high in raw cocoa beans. Clinical trials have repeatedly demonstrated that cocoa flavonols trigger the lining of the arteries to produce nitric oxide, much like beetroot juice, but they also have a unique ability to improve the elasticity of the arteries, making them more pliable and responsive to changes in blood flow demand. This is critical because stiff arteries are the enemies of good circulation. They force the heart to pump harder and resist the smooth flow of blood to the legs. By consuming high flavonol cocoa, you are essentially conditioning your blood vessels to stretch and relax properly, reducing the resistance that blood faces as it travels down to your feet. In fact, studies specifically on seniors with peripheral artery disease, a condition characterized by narrowed leg arteries, showed that those who consumed dark chocolate or cocoa could walk further and longer before experiencing pain than those who did not. I had a patient named Eleanor, 77, who loved her nightly sweets but suffered from poor circulation and high blood sugar. Her mistake was eating milk chocolate bars, which are mostly sugar and fat with very little actual cocoa. The correction was switching to a drink made with 100% unsweetened cocoa powder, sweetened lightly with stevia, and mixed with almond milk. Not only did her blood sugar stabilize, but she also reported that the cramping in her calves at night had virtually disappeared. To get these benefits, you must be very selective about the product you buy. Look for natural or raw cocoa powder, not Dutch processed or alkalized. The alkalization process makes cocoa less bitter and darker in color, but it strips away up to 60–90% of the beneficial flavonols that you need for circulation. You are looking for a lighter brown powder that tastes somewhat bitter and acidic. That bitterness is the taste of the antioxidants working. To make it, mix 1 to 2 tablespoons of this powder into hot water, or a plant-based milk like almond or oat milk. Dairy can sometimes inhibit antioxidant absorption slightly. You can add a dash of cinnamon, which also helps blood sugar control, and a small amount of a natural sweetener if needed. Treating this as a health tonic rather than a dessert changes your relationship with it and ensures you consume it regularly enough to see results. Be cautious of the calorie content if you are using high-fat milk or adding sugar, as weight gain can counteract the benefits by putting more pressure on your joints and veins. Also, be aware that cocoa contains a small amount of caffeine and theobromine, which are stimulants. So, if you are very sensitive to sleep disruptions, enjoy this earlier in the day rather than right before bed. This supports the structural flexibility of your arterial walls. 7. Low-sodium tomato juice. The final drink to discuss is low-sodium tomato juice, a powerful yet overlooked beverage for vascular health. Tomatoes are the primary dietary source of lycopene, a carotenoid pigment that gives them their red color and has strong antioxidant properties. However, for circulation, the key benefit lies in tomatoes' ability to inhibit the activity of an enzyme called ACE, angiotensin-converting enzyme, which naturally causes blood vessels to constrict. By inhibiting this enzyme, tomato juice can help keep vessels dilated and blood pressure lower, facilitating easier flow to the legs. Additionally, research suggests that extracts found in the clear jelly surrounding tomato seeds contain antiplatelet compounds that smooth out the blood, preventing platelets from becoming too sticky. Sticky blood moves sluggishly through the veins and poses a higher risk for clotting, especially in the deep veins of the legs where gravity works against blood return. Keeping the blood fluid and smooth is essential for preventing that feeling of congestion and heaviness in the lower limbs. I remember a patient named Thomas, 63, who was a long-haul truck driver and suffered from significant swelling in his ankles after long shifts. He often drank salty vegetable juice blends from gas stations, thinking they were healthy. The mistake was the massive sodium load, which caused him to retain water and worsen the swelling. The correction was switching to a specific low-sodium tomato juice and drinking it daily. The lycopene helped his vessels, and the lack of excess salt allowed his body to shed the water weight, reducing his ankle size significantly. When choosing this, the low-sodium label is non-negotiable. Regular tomato juice is a salt bomb that will raise your blood pressure and cause fluid retention, doing the exact opposite of what you want for leg swelling. You should look for brands that have less than 140 milliliters of sodium per serving, or better yet, make your own by blending fresh ripe tomatoes with a little water and straining it. Lycopene is actually more bioavailable, meaning easier for your body to use, when the tomatoes have been heated or processed. So bottled juice or juice made from tomato paste is actually superior to raw tomatoes in this specific context. Drinking 1 glass a day acts as a maintenance dose for your vascular health. It is a savory alternative to the sweet fruit juices and teas mentioned earlier, offering variety to your palate while still serving a strict biological function. You can add a dash of hot sauce or black pepper to it, which not only improves the flavor but can also slightly boost metabolism and circulation further. One caution is that tomatoes are acidic and can trigger heartburn in some seniors. If this is you, try drinking it with a meal rather than on an empty stomach. Also, tomatoes are part of the nightshade family, which a small percentage of people with arthritis find aggravating, though this is rare. This supports the smooth, fluid movement of blood through your veins. Conclusion: improving the blood flow to your legs is not about a single miracle cure, but about creating an internal environment where your blood vessels are relaxed, your blood is properly hydrated, and inflammation is kept in check. By incorporating these drinks, beetroot juice for nitric oxide, lemon water for hydration, green tea and cocoa for vessel flexibility, and ginger and tomato juice for flow, you provide your body with the molecular tools it needs to repair and maintain your circulatory system. You do not need to drink all of these every single day to see results. Simply choosing one or two to add to your daily routine can make a profound difference over weeks and months. Start with the warm lemon water tomorrow morning, as it is the easiest and most immediate step you can take. Listen to your body, observe the changes in the warmth of your feet and the stamina in your legs, and realize that you have more control over your vascular health than you might have thought. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.